This presentation is brought to you by the Colorado Neurological Institute Movement Disorder Center.
My name is Dr. Rajeev Kumar, and I am the Medical Director of the Colorado Neurological Institute Movement Disorder Center. This video reviews autonomic and sleep problems in Parkinson's disease. The neurodegeneration that occurs in Parkinson's disease affects a multitude of body symptoms. The autonomic nervous system controls regulation of automatic body function, including regulation of blood pressure, temperature control, bladder function, and bowel function. Sleep problems can be manifold in Parkinson's disease and include vivid dreams with acting out of these dreams, which we call REM sleep behavior disorder, and even excessive daytime sleepiness. Non-motor symptoms can significantly impact quality of life, and autonomic and sleep problems can even occur before motor symptoms occur in early Parkinson's disease.
Orthostatic hypotension refers to the drop in blood pressure associated with change in position, typically from lying or sitting to standing. This results in lightheadedness and may cause fainting. This reduction in blood pressure may be caused by Parkinson's disease and is also exacerbated by anti-Parkinson medication. In order to improve this symptom, we usually first reduce antihypertensive blood pressure medication and then implement certain non-pharmacological therapies, including fluid intake, taking salt tablets, increasing caffeine intake, and wearing compression hose. If these measures do not improve the symptoms of lightheadedness adequately, the medications midodrine, fluticortisone, and pyridostigmine may be used to increase blood pressure. As Parkinson's disease advances, bladder dysfunction becomes increasingly common. Typically, this results in urinary frequency and urgency. When urgency becomes troublesome, the patient has difficulty getting to the bathroom in time, resulting in incontinence. This is usually most problematic at bedtime, and reduction of fluids later in the evening may be helpful. Specific anticholinergic medication can also be helpful, such as trospium, tolterodine, and fesoterodine. Typically, medications which cross the blood-brain barrier and can cause cognitive dysfunction, such as oxybutynin, are avoided in Parkinson's disease. The gastrointestinal system is affected in most patients with Parkinson's disease. Constipation is extremely common and may even develop prior to motor symptoms. For constipation, increasing fluid and fiber intake, exercise, and the use of stool softeners and laxatives are useful. Anticholinergic medication given for treatment of motor symptoms or bladder dysfunction may worsen constipation. This should be taken into account. Another common gastrointestinal symptom is gastroparesis, or reduced speed of stomach emptying. In most patients, this does not result in symptoms, but may result in an increased time for medications such as levodopa to take effect. Erectile dysfunction affects approximately 1/3 of patients with Parkinson's disease. Treatment with Viagra and similar medications can be quite helpful. Excessive sweating may also be bothersome to patients. This can fluctuate dramatically, often in accordance with worsening of motor symptoms when the patient is in the off state. Insomnia occurs in many patients with Parkinson's disease and may be worsened by stiffness, depression, and anxiety. Behavioral therapy and sleep hygiene techniques, including maintaining a routine, avoiding bright lights, food, and exercise prior to bedtime, may be helpful. When behavioral techniques are not effective enough, use of sleeping pills or certain antidepressants may be useful. REM sleep behavior disorder refers to dream enactment, with the patient usually acting out vivid, violent dreams resulting in screaming, shouting, and fighting movements. This can cause the patient to fall out of bed, resulting in injury, or the patient may accidentally strike their bed partner. This may also be a premotor symptom and can begin before motor symptoms occur in Parkinson's disease. Treatment with melatonin and clonazepam can be helpful. Excessive daytime sleepiness may be a manifestation of Parkinson's disease itself or can be caused directly by levodopa and dopamine agonists. Many patients who have Parkinson's disease may also have sleep apnea, which often first may manifest as excessive daytime sleepiness. Treatment usually first relies on optimizing sleep at night, reducing or eliminating medications which were causing excessive sleepiness, treatment of sleep apnea if it exists, and use of stimulants such as caffeine or prescription medications modafinil or armodafinil, known as Provigil and Nuvigil. Fatigue is remarkably common in patients with Parkinson's disease, and unfortunately, there is no definitive treatment. It is important to differentiate fatigue from sleepiness since the possible treatments may differ. Exercise has been shown to be helpful in patients without Parkinson's disease and is likely helpful in patients with Parkinson's disease. If a patient's motor state is relatively undertreated, increasing anti-Parkinson medication may also reduce the effort associated with day-to-day activities, thus improving fatigue. In the past, it was thought that pain and other sensory symptoms were not a part of Parkinson's disease. More recently, it has become more clear that pain is an integral non-motor symptom of Parkinson's disease and is frequently under or unrecognized. Patients with Parkinson's disease may have an increased sensitivity to painful stimuli compared to normal individuals. Aching or heaviness in the most affected parts of the body, feelings of internal tremor, and dystonic posturing may all contribute to pain. Many patients with Parkinson's disease may also have restlessness, called akathisia, or have typical symptoms of restless leg syndrome. Both restless leg syndrome and akathisia usually respond to an increase in anti-Parkinson dopaminergic medication.
Parkinson's disease is increasingly being recognized as a multisystem disorder. As a result, there are a wide variety of non-motor symptoms which can significantly contribute to disability. Some of these non-motor symptoms, such as fatigue and constipation, can be virtually universal. I hope that you have found this video to be helpful and will tune in for subsequent presentations as part of this Parkinson's disease educational video series.